Hi guys, I've come to you with a webinar on unlocking the secret of NDIS plan review, expert tips for a successful review. This webinar is mostly for providers who are about to do a review for their clients, as well as NDIS participants who are self-managed and also capable of advocating for themselves during review. Before I start, I would like to do acknowledgement to the country. Our team at InterHealth Services would like to acknowledge the traditional custodian of the country throughout Australia. We pay our respect to elders, past, present, and emerging, and extend that respect to all Aboriginal and Torres Islander people today. So these are the topic that we're going to talk about. We're going to cover introduction. Obviously, I'm going to talk a little bit about myself and my experiences. And the course session is going to cover the definition and objectives of plan review, gathering essential information, develop comprehensive support plan, presenting your plan, and creating interesting and engaging interaction during plan. Also addressing objections and finalizing your plan. Your experience and feedback as well will be greatly appreciated. And then we'll conclude our webinar. My name is Odia Patience Diessa, and I'm a principal therapist at InterHealth Services and director. I have a lot of experience in mental health fields. I did a lot of clinical care coordination in mental health, and for over 7 years now. And I'm accredited mental health social worker, and I practice as a private practitioner at the moment. I also have over 15 years of experience in disability field, so I'm quite aware of most of the clients, what they need, and how to appropriately advocate for the clients. So, before you even decided to do a review for your participants, you need to define the objectives of that review and what you want to get out of it, the outcome of it. You need to capture and chunk all action leading to that point. Ensure a comprehensive mental health support plan. When I'm talking about mental health, so this webinar, it's basically for any client with psychosocial disability or physical disability. However, given that we specialize in mental health, so we're going to talk a lot about mental health and psychosocial disability. But you can apply these skills to any of your client with different challenges. So before you even when you're about to do a review, it's okay to have a guide. It's okay to prepare like a booklet or a guide from NDIA website. They have tons of templates that they do offer, and to put your ideas together. And there are some other organizations such as Feral Care and CASA who developed a book that state my NDIS plan. Basically, for people who are trying to access their NDIS for the first time, but the same rules applied when preparing for review. Even if the client have already been approved and still wanna do a review with their area local coordinator. So improve overall well-being and quality of life. So basically, why are we even doing a review? These days, clients get their plans or automatically renewed without doing a review. But you, as a service provider, you know when your clients' needs are being met and they are not being met. So it's your job to actually request for that review, not to just leave it, oh, it's just been rolled over. But you know your client are struggling to have the services that they need to access so that they can have a meaningful life. You can also use an example of a rapid planning method, um, which is also was developed by an entrepreneur in America. And so Tony Robin, the purpose of this is just to plan. It's a planning system designed to help people achieve their goals more effectively and live a meaningful and fulfilling life. So if you pay attention to what I'm saying and you use exactly, the rules and the guidelines that I'm gonna recommend for you, you have a very high chance of advocating for your client for either a better funding or better service that can improve their lives. When you are using a rapid NDIS review, so have a look at an example where you have to schedule services such as therapy sessions, have to be regular review of medication, and also include any activity, physical activity, day options, community, and social participation, because these are the evidence that will need to show the need for clients and also the improvement and where they're lacking. So while you are preparing for the plan, you need to gather your evidence, create your own RPM. So that plan, you need to make sure you collect all the relevant information, medical reports, psychological reports, counselors' reports, psychiatrist reports, care coordinators report, including families as well. Feedback from families is very important. Sometimes we disregard families' inputs. When we say personal centered approach, clients say that the family input is also included, regardless. We also know that sometimes families can be very sensitive when talking about their loved ones, but their opinion is just as valid. And yeah, so make sure everybody involved in the client's life provide their reports and updates. An example is leverage, work with the health professionals, health providers that are involved in the client. We've already talked about the GPs. The GPs are the one who prescribe medication for the client. They are the one who knows whether the medication is working or not. And allocate specific time to actually accompany your clients to those meetings and collect evidence. And the best people to work with, they are support workers as well. Sometimes, if you are in a managerial position or support coordinators, people are very busy and do not have time. Assign tasks. It's better to go there and advocate for your clients yourself, but you can assign tasks, your support workers, and instruct them on exactly what to get when they support the client to health providers. Prioritize the needs as well. Ensure all documentation are ready before the review. Um, Now, while you're developing a comprehensive plan, use a guide. Use a guide. Do not just collect information and sometimes you don't know where you're putting the client information. And during the review, then you're like, oh, have I received a report? Have I not? Create your own checklist. Create your own checklist where you're ticking every document that you got. I got an example of, I think, during my when I was a clinician, there was a client that I was providing clinical care coordination for, and she was about to have her NDS review. And I contacted the support coordinator, and they couldn't, first of all, they couldn't even get back to me. After weeks, then the client told me, oh, they changed their support coordinator. And then I had to call and contact the new support coordinator. And they didn't even know what the client needed, what the clients supposed to gather. It was just a bit of a mess. It was just disorganized. Even though it wasn't my job to collect evidence, I made sure the clients had every document that they needed to provide to the local area coordinator. And I rang up and I double checked what sort of document they have ready, because the meeting was coming up next week. I needed to make sure they have all the reports, all the necessary documentation already sent to them. I think you're going to do a client a favor if you have all the document already sent to them, and also have a physical copy of all the evidence that you need. And in the end, it was a very good advocacy and a very successful meeting for the client. And she ended up getting a lot of money, a lot of funding that she needed to be able to access services and have a meaningful life. Now, while you're presenting your plan, you're in the meeting with the local area coordinators with your client. Now, while you're presenting your plan, you need to create rapport with the people you are presenting it to. Show that you care deeply about the individual you are supporting, and you are really committed and committed to collaborate with them as well. Um, An example would be using listening skills. When they're talking, make sure you also use nonverbal skills, and try not to be interruptive, and also wait for your turn to actually ask questions. I know sometimes the time can be limited, but it's okay. It's okay. When you have time, just get to the point of what you want to advocate for your client. Share personal stories, successful stories about your client, and how you successfully support them to access services, and how it has helped them improve. Now, creating an interesting engagements. You need to be able to actually grab the planner's attention. Present your plan in a visual manner. As I said at the beginning, you can be prepared, have the form ready, have all the reports ready. Even though they're meant to have all the documentation, still have them visual there so that they can, reflect on it. And also have a copy ready for them even to take away as well. Because how many times have you come across people, they're in the meeting and they're the organizer and they're supposed to have everything ready, but they don't. So by you actually presenting them, you're actually doing your client a favor, because they may as well just overlooked that important document that was supposed to advocate for your client and get more funding or more support. Um, so an example would be talking to your a very engaging conversation with the planner would be, our proposed plan will significantly improve mental health outcome because it includes evidence-based therapists and consistent support. So when you're doing that, you already have the report from your psychiatrist, from your psychotherapist, from accredited mental health social workers, or any social workers who are, or counselors who are providing the therapy, psychological treatments. So you already have the evidence there stating that, and their recommendations as well. And this would be um, why the individual need more support, so that the individual will experience or reduce anxiety and improve their daily functioning or quality of life. So provide those evidence already. Addressing objections and finalizing the plan. It's okay to have some objections in the during the review. As long as you have evidence, you'll be fine. And sometimes people get scared during a review, and you feel a bit less about yourself. You are not confident enough. Just because they are local area coordinators, it does not mean that you cannot speak for your client. You need to be able to speak and advocate for your client, because you know your client better than they do. And if this is something that does not align with the fact of what the client is going through, find ways, use strategies to be able to convince them on why they should give the client that. Prepare in advance some of the questions that they may ask and the responses that you may give. So before even you meet the local area coordinator, practice this session with your clients, and get them prepared as well. Because most of the clients are actually involved in their review. And for clients who have psychosocial disability, who are on heavy medication, such as schizophrenia and personality disorder, those people, they can fluctuate in their mood. So you have a plan, um, a session, and then they're heavily medicated and they end up sleeping. So there's no way they can actually advocate for themselves. So if you don't speak up for them, that's it. You've missed the opportunity to getting them a very increased service or more funding, or to actually access funding for the clients, for themselves. So an example would be, why do you need to include weekly therapy sessions? I have a lot of clients. My clients, when I'm preparing a reports, because it has to be an interactive and collaborative relationship with client, and I'm like, how many sessions do you think you need? That I need to include in the report. And I have clients who said weekly session. So depend on your client needs, weekly session. But the area coordinator may disagree with you. They may say, why weekly session? Because most of the client access to session a month or once a month, depending on their need. But you need to have evidence why. I have a client who is very isolated, and she likes she doesn't trust people. She has paranoia. She thinks people are always talking about her, but they feel safe when they're in the session. They open up, and they want to do that every week. So again, you need to be able to advocate. If you don't know why the psychiatrists or psychologists or therapists are recommending weekly, talk to them and let them give you more explanation as to why they need weekly. It's usually included in the report anyway, but if you need more information, pick up the phone, ring, and get some more information. And some of your response, yeah. So once you're prepared, you give a response like, weekly sessions are essential for consistent progress and preventing a relapse, as shown by these reports. That no one's gonna argue with you, because first of all, they may not even know about those reports. They may not even look at it. As soon as you said, as it mentioned in the report, you actually just shut them out, like they will be quiet basically. And then you actually sending them to go and double check in the report what was actually recommended. So in conclusion, we we've talked about defining a clear client objective and effective for getting effective NDIS review. We've talked about gathering information. So client data supports. So while the client is already accessing the service, make sure they use their funding, they access their social and community participation. Those are the evidence that are going to help you to prove that, okay, this is what they've been accessing and this is where they are at and this is what they need. So develop a tailored support plan with personalized care. Put some work into it. Plan it properly and you won't be disappointed. Engage stakeholders with empathy and evidence-based strategies. So the stakeholders, again, it's the planner, the reviewer, the person who's reviewing the clients, and also you can actually have other people, other providers who are actually willing to come and support the client, if especially for very complex clients. It's very essential. Um, with and address concerns as well. So obviously, the review you're asking for it, especially if the client have already been approved, there is some concerns that you need to address. Address those concerns and advocate for more funding. Celebrate once the plan has been reviewed, the money has been increased. Celebrate with the client. That it's actually fulfilling for you as a provider. It shows that you've done a good work. Also, for your client, it's a big achievement. It's something that they've been involved in, and it boosts up their self confidence. It's also provide a fulfilling kind of feelings as well. They're like, yeah, I did it. And then when you try and involve them in some other project, they will know that, okay, I've done this before, I can do it again. Now it's time to for you guys to give us a feedback. So use the QR codes and tell us about your experience and feedback areas that we can improve on, some topics that you want to recommend. So if you enjoyed this one, this is going to be uploaded on YouTube. If you want more and you want an update, please share, like, and subscribe. Otherwise, we're here. If you recommend more webinar like this, we're here to provide it for you. Oh, before I go, I will also talk to you about InterHealth Services. So, as I said, I'm a principal therapist at InterHealth Services, and one of the main services we provide is psychotherapy and counseling. So, our highly recommended service is assessment and recommendation. And for the reason that we are all here today, is for reviews, for new access to the NDIS. So we do psychosocial assessment and reporting, and we do cross-cultural psychosocial assessment and reporting for those people with code client or cultural clients. We use a special tools that can also include information on how the client can be treated, on how the client preferred to be addressed, and all those cultural barriers that support workers have difficulty dealing with or not understanding. So we'll include that in the report to help you support your client better. And functional capacity assessment as well. And this is a bigger addition to our services. And it's on highly on demand. So if you want any of these assessment, just reach out. Our contact information will be at the end, and it will be at the end, and you can just Google us. You'll find us InterHealth Services, and we also have mental health social work services. This is fits between um, more like a level 3 support coordination, but it's not specific, so it's included. So when the client is accessing mental health social work services, they are also within that, they can also access those level 3 support coordination as well as the therapy within that. We can provide all of it and those psychosocial needs. But when they're receiving just a therapy, it's only therapy. But mental health social work services, it's very holistic. We also have a well-being program and mentorship. The well-being program, it's for employees who want to provide a well-being program to their employees to reduce stress. We all know the industry is very busy, and yeah, very busy and stressful industry. You need to look after your employees. Otherwise, you won't have employees to take care of your clients so you can be able to do your work as well effectively. And we also organize some well-being program for clients, such as mindfulness, thought therapy, and also group therapy. Mentorship, we mentor people who want to get more experience in mental health. This is in a professional level, so it could be new social workers who want to get more experience in mental health. So we provide supervision and also guidance on how they are doing their work. We also provide psychosocial recovery coaching, which falls under mentorship. Now, this one is for clients. Mentorship and how they can basically navigate their day to day life and get more resources and get more educated on their mental health or psychosocial disability. We have physio as well who can do assessment, recommendation, and also exercises. On that note, I leave you with to ask question and answers if you have any. And again, this is our information, so please feel free to contact us anytime. And you can leave your feedback here, given that this is a webinar, it's not a live session. So leave your feedback, reach out if you need more information, reach out if you need more training. And yeah, basically that's it. So you guys take care and watch out for more training as they arrive as well. So for people who are participating in the live webinar, they'll have the opportunity to actually have a certificate of attendance. So next time you see it, please book so that you have the opportunity to have evidence for your professional development. Thank you. Bye. Don't forget to like, share, and subscribe.